Picture this: a couple in their 70s, holding hands, sharing laughter, and still enjoying a deeply fulfilling intimate life. Society often paints aging as a time when romance fades and physical connection diminishes. But is that really true? Many older adults believe intimacy is only for the young, yet science tells a different story. Sex doesn't come with an expiration date. In fact, it plays a vital role in maintaining mental, emotional, and physical well-being as we age. In this video, we'll uncover the truth about intimacy in later life, debunk common myths, and discuss how often older adults should be having sex. Stay with me until the end, because I'll share a powerful yet often overlooked insight that might completely change the way you think about intimacy in your golden years. Part 1. The importance of intimacy as we age. Too often, conversations about aging and intimacy are clouded by outdated societal beliefs. Many assume that as we grow older, sex becomes irrelevant or unnecessary. However, research proves otherwise. Maintaining intimacy can lead to longer, healthier, and happier lives. The physical, mental, and emotional benefits of intimacy remain crucial at every stage of life, especially in our later years. Physical benefits of sex for older adults. 1. Heart health. Engaging in sexual activity increases blood circulation, strengthens the heart, and helps regulate blood pressure. Some studies even suggest that regular intimacy can reduce the risk of cardiovascular disease. As we age, heart health becomes a primary concern, and intimacy can serve as a natural way to promote a stronger cardiovascular system. 2. Pain relief. Ever noticed how body aches and pains sometimes fade after intimacy? That's because sexual activity triggers the release of endorphins, the body's natural painkillers. This can be particularly helpful for those struggling with arthritis or chronic pain. The physical closeness of intimacy also helps release oxytocin, a hormone that reduces stress and promotes relaxation. 3. Better sleep. Struggling with insomnia? Intimacy can help. The release of oxytocin and other relaxation-inducing hormones after intimacy promotes better, deeper sleep. Many older adults struggle with sleep disturbances, which can negatively affect overall health. Engaging in intimacy can provide a natural way to encourage restful sleep, leading to improved mood and cognitive function. 4. Improved mobility and flexibility. Regular movement, including sexual activity, helps keep joints limber and muscles engaged, reducing stiffness and increasing flexibility. As we age, maintaining physical mobility is essential for independence and quality of life. Intimacy can be an enjoyable way to stay physically active while also enhancing overall well-being. Mental and emotional benefits. 1. Reduced anxiety and depression. Intimacy fosters emotional connection, decreasing feelings of loneliness and isolation, which are common in older age. Physical touch and close relationships help release serotonin and dopamine, neurotransmitters that promote happiness and reduce stress. Those who engage in regular intimacy often report greater overall satisfaction with life and a reduced risk of depression. 2. Memory boost. Believe it or not, sex can help keep your brain sharp. Studies suggest that engaging in intimacy strengthens neural connections and may reduce the risk of cognitive decline. The hormones released during intimacy contribute to neurogenesis, the process of creating new neurons, which is essential for maintaining cognitive function as we age. 3. Emotional bonding. Feeling desired and loved is a fundamental human need. Intimacy strengthens emotional bonds and reinforces a sense of belonging. Many older adults experience life changes such as retirement, loss of a spouse, or children moving away. Maintaining an intimacy with a partner can provide comfort, reassurance, and a deeper connection, fostering emotional well-being. While intimacy offers numerous benefits, some older adults face challenges that make it difficult to maintain a satisfying intimate life. However, most barriers can be addressed with the right approach. Aging brings changes in hormone levels, which can impact libido and sexual function. Women may experience vaginal dryness due to decreased estrogen levels, while men may face erectile difficulties. Fortunately, there are various medical and lifestyle solutions available, such as hormone therapy, lubricants, and medications designed to enhance sexual function. Diabetes, heart disease, arthritis, and other chronic conditions can affect sexual activity. However, these conditions do not have to mean the end of intimacy. Open communication with a healthcare provider can help identify safe ways to maintain a fulfilling intimate life. Adjustments, such as changing positions, using supportive cushions, or engaging in non-penetrative forms of intimacy, can also help maintain connection. Many older adults take medications for various health conditions, some of which can affect sexual desire and function. If medication side effects are impacting intimacy, discussing alternatives with a doctor can help. Adjusting the timing or dosage of medication may alleviate unwanted side effects while still managing health conditions effectively. Fear of rejection, body image concerns, or past trauma can create barriers to intimacy. Honest communication with a partner about feelings, fears, and desires is essential. Couples therapy or support groups can also provide guidance for those who may struggle with emotional barriers. Intimacy does not have to be solely about sex. Many older adults find deep fulfillment in other forms of closeness, such as cuddling, holding hands, or sharing meaningful conversations. Non-sexual intimacy plays a crucial role in maintaining emotional bonds and can be just as important as physical intimacy. Encouraging healthy intimacy in later life, open discussions with a partner about needs, desires, and concerns create a strong foundation for intimacy. It is essential to prioritize emotional connection alongside physical closeness. Spending quality time together, sharing experiences, and showing appreciation for one another strengthens relationships. Acts of kindness, words of affirmation, and small gestures can go a long way in maintaining emotional intimacy. A healthy lifestyle contributes to overall well-being, including sexual health. Regular exercise, a balanced diet, and stress management can improve energy levels and promote a positive self-image, all of which contribute to a fulfilling, intimate life. Intimacy remains an essential part of life, no matter our age. The physical, mental, and emotional benefits of maintaining intimacy contribute to overall well-being and quality of life. By embracing changes, communicating openly, and seeking solutions to potential barriers, older adults can continue to experience deep connection and fulfillment in their relationships. Aging should not mean the end of intimacy, but rather an opportunity to explore new ways of maintaining closeness, love, and connection. Part 2. How often should older adults be having sex? There's no magic number, and that's okay. The question of how often older adults should be having sex does not have a one-size-fits-all answer. Sexuality is deeply personal and varies depending on a range of factors, including health, emotional connection, lifestyle, and individual desires. The most important aspect is not necessarily the frequency of sexual activity, but rather the quality of intimacy and the level of satisfaction between partners. For many older adults, sexual intimacy remains a crucial component of emotional well-being and overall quality of life. However, changes in health, hormone levels, and relationship dynamics can influence both the desire for and ability to engage in sexual activity. Understanding these factors can help older adults and their partners navigate this phase of life with confidence and fulfillment. Several studies have examined sexual activity among older adults and its impact on overall health and happiness. A study from the National Library of Medicine found that adults over 65 who engaged in sexual activity at least once a week reported higher levels of happiness and life satisfaction. However, frequency is just one part of the equation. Other studies suggest that the key to sexual well-being is mutual fulfillment rather than adhering to a specific number of encounters per week or month. In a study published in the Archives of Sexual Behavior, researchers found that older adults who remained sexually active tended to report better overall health and cognitive function. Sexual activity has been linked to increased circulation, the release of endorphins, and even improved immune function. Another report from the University of Chicago's National Social Life, Health and Aging Project, NSAP, found that approximately 40% of individuals between the ages of 65 and 80 remain sexually active. This suggests that while sex may become less frequent with age, it does not necessarily disappear from one's life altogether. While the desire for intimacy often persists well into later life, several factors can influence how often older adults engage in sexual activity. These factors include 1. Physical health. Sexual activity is closely tied to physical health. Conditions such as heart disease, diabetes, arthritis, and high blood pressure can impact sexual performance and desire. For men, erectile dysfunction, ED, may become more common, while women may experience vaginal dryness or decreased libido due to hormonal changes. However, many of these issues can be managed with lifestyle changes, medications, and open conversations with healthcare providers. Staying active, maintaining a healthy diet, and managing stress can also contribute to a more satisfying sex life. 2. Emotional and psychological well-being. Mental health plays a significant role in sexual desire and satisfaction. Anxiety, depression, and stress can reduce libido, making intimacy less appealing. Additionally, body image concerns may become more prominent as people age, affecting confidence in sexual situations. Couples who openly communicate about their feelings and insecurities often find that emotional connection enhances physical intimacy. Practicing mindfulness, engaging in stress-reducing activities, and seeking therapy when needed can help maintain a positive outlook on sexuality. 3. Relationship dynamics. Long-term relationships evolve over time, and intimacy can change in response to life circumstances. Some couples may experience a deepening of their emotional bond, leading to greater sexual satisfaction, while others may encounter challenges such as routine fatigue or differences in libido. Effective communication is key to maintaining a healthy sex life. Discussing desires, concerns, and expectations can foster understanding and prevent misunderstandings. Even non-sexual forms of intimacy, such as hugging, kissing, and cuddling, can help maintain closeness. 4. Medications and medical conditions. Certain medications, including those for high blood pressure, depression, and anxiety, can affect sexual desire and performance. It's important for older adults to talk to their doctors about any side effects they may be experiencing. In many cases, alternative medications or lifestyle adjustments can help mitigate these effects. Number 5. Hormonal changes. Aging brings hormonal changes that can affect libido. In women, menopause leads to a decline in estrogen levels, which can result in vaginal dryness and discomfort during intercourse. For men, lower testosterone levels can contribute to reduced sexual desire and erectile difficulties. Fortunately, treatments such as hormone therapy, vaginal lubricants, and medications for erectile dysfunction can help address these concerns. Consulting a healthcare provider can provide guidance on the best options for maintaining sexual health. Sexual activity is just one aspect of intimacy. Many older adults find that emotional closeness, affection, and companionship become even more meaningful with age. Holding hands, sharing laughter, expressing gratitude, and engaging in meaningful conversations can all contribute to a fulfilling, intimate relationship. Some couples transition from frequent sexual activity to other forms of closeness, such as massage, slow dancing, or simply spending quality time together. These activities can strengthen relationships and maintain a deep sense of connection. For those who want to maintain or improve their sex life as they age, here are some practical tips. 1. Communicate openly. Talk about your desires, concerns, and expectations with your partner. Honest conversations can lead to greater understanding and intimacy. 2. Prioritize physical health. Regular exercise, a healthy diet, and proper sleep contribute to overall well-being and sexual health. 3. Explore different forms of intimacy. Intimacy doesn't always have to be about intercourse. Kissing, touching, and spending quality time together can be equally fulfilling. 4. Address medical concerns. If health issues are affecting your sex life, consult a doctor to explore treatment options. 5. Try new things. Experimenting with different forms of intimacy, positions, or settings can bring excitement and variety. 6. Manage stress. Stress and anxiety can negatively impact libido. Engage in relaxation techniques like meditation, yoga, or deep breathing exercises. 7. Seek professional guidance. If you or your partner are experiencing sexual difficulties, consider talking to a therapist or sex counselor. Ultimately, there is no right or wrong frequency when it comes to sex in older adulthood. The most important thing is to focus on what feels right for you and your partner. Whether you engage in sexual activity once a week, once a month, or choose to express intimacy in non-sexual ways, the key is to prioritize mutual satisfaction and emotional connection. Aging does not mean the end of a fulfilling sex life. It simply means adapting to new circumstances and finding joy in the evolving nature of intimacy. By maintaining open communication, prioritizing health, and embracing different forms of closeness, older adults can continue to enjoy meaningful and satisfying relationships well into their later years. Part 3: Overcoming common barriers to intimacy in older age. As we age, our bodies and minds undergo significant changes that can impact our intimate lives. While these changes may present challenges, they do not have to mark the end of intimacy. Instead, by understanding and addressing common barriers, older adults can continue to enjoy meaningful and fulfilling connections with their partners. Below, we explore some of the most prevalent concerns and practical solutions to help maintain intimacy in later years. 1. Health challenges and mobility issues. As we grow older, health conditions such as arthritis, cardiovascular disease, or limited mobility can make traditional forms of intimacy more difficult. Pain, fatigue, and physical limitations may create barriers to sexual activity. Solution: adapt positions that require less physical effort. Utilize pillows or supportive cushions to increase comfort. Explore alternative forms of intimacy, such as cuddling, massage, or sensual touch. Consider physical therapy or gentle exercise to improve flexibility and reduce discomfort. Do not hesitate to consult a doctor about options for maintaining intimacy, including medications, mobility aids, or tailored physical therapy programs. Communication with a healthcare professional can provide solutions that enhance comfort and pleasure. Aging does not mean the end of a fulfilling sex life. It simply means adapting to new circumstances and finding joy in the evolving nature of intimacy. By maintaining open communication, prioritizing health, and embracing different forms of closeness, older adults can continue to enjoy meaningful and satisfying relationships well into their later years. Part 3: Overcoming common barriers to intimacy in older age. As we age, our bodies and minds undergo significant changes that can impact our intimate lives. While these changes may present challenges, they do not have to mark the end of intimacy. Instead, by understanding and addressing common barriers, older adults can continue to enjoy meaningful and fulfilling connections with their partners. Below, we explore some of the most prevalent concerns and practical solutions to help maintain intimacy in later years. 1. Health challenges and mobility issues. As we grow older, health conditions such as arthritis, cardiovascular disease, or limited mobility can make traditional forms of intimacy more difficult. Pain, fatigue, and physical limitations may create barriers to sexual activity. Solution: adapt positions that require less physical effort. Utilize pillows or supportive cushions to increase comfort. Explore alternative forms of intimacy, such as cuddling, massage, or sensual touch. Consider physical therapy or gentle exercise to improve flexibility and reduce discomfort. Do not hesitate to consult a doctor about options for maintaining intimacy, including medications, mobility aids, or tailored physical therapy programs. Communication with a healthcare professional can provide solutions that enhance comfort and pleasure. 4. Social stigma and cultural beliefs. In many societies, older adults are often overlooked when it comes to discussions of love and intimacy. Cultural norms may suggest that passion is reserved for youth, causing embarrassment or reluctance to discuss sexual concerns. Solution: challenge outdated beliefs that intimacy has an expiration date. Engage in open discussions with peers, healthcare providers, or support groups. Recognize that emotional and physical closeness are lifelong needs, not bound by age. Many cultures are shifting toward a more inclusive view of aging and sexuality. Films, books, and medical research increasingly highlight that older adults deserve fulfilling intimate lives just as much as younger generations. 5. Loss of a partner and fear of starting over. Losing a spouse or long-term partner can deeply impact one's sense of identity and relationship with intimacy. Many older adults struggle with the idea of finding love again or navigating dating after many years. Solution: take time to grieve and heal before pursuing new relationships. If interested in dating, explore social groups, senior dating sites, or local community events. Focus on companionship first, allowing intimacy to develop naturally. After losing her husband of 45 years, Joan, 72, believed she would never experience love again. However, through a senior yoga class, she formed a deep friendship with a kind-hearted man. Over time, their bond grew into something more. reminding Joan that love and intimacy can flourish at any stage of life. 6. Communication barriers between partners. Long-term relationships often develop routines, sometimes leading to a lack of communication about intimacy. Assumptions, misunderstandings, or past conflicts may prevent couples from expressing their needs. Solution: schedule time for honest and open conversations about desires and concerns. Use gentle language and reassurance rather than criticism or blame. Consider relationship counseling if communication barriers persist. John and Susan, both in their late 60s, found that their intimacy had faded over the years. Through counseling, they realized that unspoken frustrations had built up. Once they started openly discussing their needs, their physical and emotional connection improved significantly. 7. Medication side effects and medical conditions. Certain medications, such as those for high blood pressure, depression, or diabetes, can negatively impact libido and sexual function. Chronic illnesses may also contribute to fatigue or discomfort. Solution: consult a doctor to adjust medications or explore alternatives with fewer side effects. Focus on pleasure beyond intercourse, including sensual touch and emotional intimacy. Maintain a healthy lifestyle through diet, exercise, and stress management to support overall well-being. Many health conditions and medications have alternative treatment options. Seeking professional guidance can help tailor solutions to improve both health and intimacy. Aging brings changes, but it does not mean the end of intimacy. By adapting to physical changes, maintaining open communication, and prioritizing emotional connection, older adults can continue to enjoy deep and meaningful relationships. Intimacy is a lifelong journey, evolving with time, but never losing its value. Whether through touch, companionship, or heartfelt conversations, love and closeness remain essential parts of a fulfilling life at any age. Part 4. Redefining intimacy. It's about more than just sex. Aging brings wisdom, experience, and an opportunity to reshape our understanding of intimacy. In our younger years, intimacy is often associated with passion and physical connection. However, as we grow older, intimacy becomes a richer, deeper experience that encompasses emotional closeness, mutual understanding, and shared moments of genuine connection. Throughout life, our perception of intimacy shifts. In our younger years, the focus may be on physical attraction and romance, but as we age, we begin to appreciate intimacy in ways that transcend the physical. Emotional security, companionship, and deep conversations take center stage. While physical intimacy remains an important part of relationships at any age, the emphasis often shifts toward experiences that foster emotional bonds and companionship. For many older adults, intimacy is about feeling seen, heard, and valued by their partner. Intimacy is not defined by grand gestures or dramatic moments, but rather by small, meaningful interactions that create a sense of closeness. These can include holding hands on a morning walk. A simple touch can speak volumes, offering reassurance and warmth. Watching a sunset together. Shared appreciation for life's beauty creates an unspoken bond. Whispering sweet nothings before bed. Expressing love and affection reinforces emotional connection. Surprising each other with small gestures of love, a handwritten note, a cup of coffee made just the way they like it, or an unexpected compliment can deepen intimacy. Intimacy is not measured in numbers, it is measured in the moments that make us feel deeply connected to our partner. Aging does not mean the end of intimacy. Rather, it presents an opportunity to embrace new dimensions of closeness and connection. Here are key takeaways for cultivating intimacy in later life. 1. Sex has no expiration date. While physical intimacy may evolve with age, it never loses its importance. The idea that intimacy has an expiration date is a misconception. Many older adults continue to enjoy a fulfilling sex life, adapting to changes with openness and communication. Sexual expression remains a powerful way to connect, and the emotional intimacy that accompanies it can be even more meaningful with age. It is not about performance, but about closeness and mutual satisfaction. 2. Quality over quantity. A fulfilling, intimate life is not about frequency, but about connection. Whether it is through physical touch, shared laughter, or deep conversations, intimacy is about how present and engaged partners are with one another. For older couples, focusing on emotional fulfillment rather than physical expectations can lead to a richer, more satisfying experience. Number 3, communication is everything. Open and honest communication is the foundation of intimacy. Talking about needs, fears, and desires ensures that both partners feel heard and understood. As bodies change and life circumstances shift, discussing comfort levels, expectations, and emotional needs becomes even more important. Being able to express vulnerabilities and desires without fear of judgment strengthens the emotional bond between partners. 4. Adapt and overcome life presents challenges, and intimacy is no exception. Health conditions, medications, and physical limitations may require adjustments in how couples express closeness. The key is to remain open to new ways of connecting. For example, if mobility issues make certain physical activities difficult, couples can explore alternative forms of intimacy, such as massage, cuddling, or non-sexual touch that fosters connection. Emotional barriers can also emerge with age, whether due to past experiences, insecurities, or the fear of rejection. Addressing these barriers with understanding and compassion can help partners reconnect on a deeper level. 5. Confidence is attractive. Feeling desired and valued is not about age or appearance. It is about connection and self-acceptance. Confidence comes from embracing who you are at this stage of life and recognizing that intimacy is about sharing love and trust with your partner, rather than dwelling on societal expectations or past versions of yourself. Focus on the present moment and the connection you share with your partner. Confidence and self-acceptance are incredibly attractive and can enhance intimacy in profound ways. Intimacy is not limited to romantic relationships. It extends to deep friendships, family connections, and even self-love. Cultivating intimate relationships outside of romantic partnerships can provide immense emotional fulfillment. For example, friendships. Engaging in meaningful conversations and shared activities strengthens bonds with close friends. Family relationships. Expressing appreciation and love for family members nurtures emotional closeness. Self-intimacy. Taking time for self-reflection, self-care, and personal growth fosters a deeper understanding and appreciation of oneself. Recognizing and nurturing intimacy in all aspects of life leads to a more fulfilling and connected existence. Aging is not a barrier to intimacy, it is an opportunity to redefine and deepen it. By shifting the focus from physical performance to emotional connection, couples can create a more meaningful and lasting bond. True intimacy is about presence, connection, and love in all its forms. Whether through touch, conversation, shared experiences, or simple acts of kindness, intimacy remains a vital and enriching part of life at any age. Embrace the journey of intimacy in your golden years with openness, confidence, and a willingness to connect in new and profound ways. The most beautiful connections are the ones nurtured with love, patience, and mutual appreciation. No matter your age, intimacy is a gift that continues to enrich our lives. It is not just about physical closeness, it's about emotional connection, trust, and companionship. As we grow older, the ways we express intimacy may change, but the need for love, affection, and deep connection remains just as important. Whether it's holding hands, sharing meaningful conversations, or simply being present for one another, these moments strengthen the bonds that keep relationships thriving. For some, intimacy may mean regular physical close, while for others it may take the form of tender gestures, laughter, or even a reassuring touch. The key is to embrace what feels right for you and your partner, without pressure or comparison. A fulfilling, intimate life is not measured by frequency, but by the warmth, joy, and sense of belonging it brings. What are your thoughts on intimacy as we age? Have you discovered new ways to connect with your partner? We'd love to hear from you. Drop a comment below and share your experiences. If you found this video insightful, don't forget to like, subscribe, and hit the notification bell. Stay tuned for more discussions on health, wellness, and relationships in later life. Remember, aging isn't about losing intimacy, it's about rediscovering it in new and meaningful ways. See you in the next video on Golden Years Balance.